In these difficult economic times, Harrow Council is facing some tough choices about its spending. Central government is cutting the funding it gives to all local authorities across the country. This means that over the next few years, Harrow has to make savings of 25% across all its services. Adult Services is no exception. This year the department's budget is £81 million, and we're looking at ways to find savings of at least £16 million over the next 3 years. Some of that will be achieved by improving our back office operations and efficiency, but unfortunately we will have to also find savings from the services we deliver, such as Meals on Wheels or community transport. This is going to be challenging, and we are committed to providing high quality, safe and efficient services for all our users. To do this, we are holding a consultation where you can give us your views on our proposals and help us identify the best ways to save money while minimising the impacts on users.
Nobody is going to be asked to pay for a service that is assessed as a need if they can't afford to pay for it. But what we're absolutely certain is we're going to provide the services, we're not going to cut them, and nobody will be asked to pay if they can't afford to.
We are looking at making savings in 4 areas: Meals on Wheels, community transport, concessionary travel and contributions to care. This video will show you some of the changes we are considering and how they might affect you.
Good afternoon, Mrs. Gilbert.
Hello, Sharon.
How are you?
The way you use and pay for your services is changing. Care services are moving towards a more personalised framework, which gives service users much more control, choice and flexibility in how they plan and manage their care needs. The amount you will have to contribute towards your adult social care will be determined by a financial assessment process, which will look at your individual needs and circumstances. First of all, you'll receive a care needs assessment. This is a supported self-assessment process to determine what your needs are and what level of support you require. Harrow Council currently assesses people as eligible for support when their needs are critical or substantial, and this will remain unchanged. Using its resource allocation system, the Council will then draw up your indicative personal budget and care plan, which outlines what services you require, on what basis you require them and how much they will cost. A financial assessment will then be carried out to see if you're able to make a contribution towards the cost of your care. You will then be asked whether you want to make your own care arrangements or whether you want the Council to manage your care plan on your behalf. So what do the financial assessment and personal contributions actually mean for you? Under the current system, the maximum anyone has to contribute towards the cost of the services they use is £250 a week. This means that where an individual's care plan costs more than £250, the Council pays the difference regardless of the user's personal circumstances. One of the key proposals we're putting forward is removing the £250 ceiling on the charges for those who are in a better financial position and who can afford to contribute more. Let's take a look at what this might mean in practice for one of our users. This is Mary. Her home care costs £300 a week in total, and under the current system she contributes the maximum £250 a week towards it. The shortfall of £50 is made up by Harrow Council. Now let's look at how Mary's situation might change if the £250 ceiling on contributions was removed. Mary was financially assessed as being able to contribute a little more each week towards the cost of her care, an extra £20, taking her contribution to £270. The cost of her care remains the same at £300 per week, so now the Council's contribution drops down to £30 per week. Another key proposal we're putting forward is to introduce something called a tariff income for non-residential social care services, such as day centre activities. A tariff income is calculated by working out the value of any savings or assets you have within a certain threshold. Guidance from central government recommends that the tariff income threshold is set between £14,250 to £23,250. Generally speaking, most types of savings will be counted, as will investments such as ISAs, shares and premium bonds. The value of any land or property you own other than your main residence is also included. The value of your home where you normally reside is not used when calculating your contribution. So how does the tariff income work? Meet Paul. His personal budget for his care needs has been calculated to cost £150 per week, and he currently contributes £75 per week towards it, with the council paying the remaining £75. Paul has savings of £15,750. If a tariff income were introduced, his contribution would increase by £1 for every £250 between the lowest end of the tariff income threshold and the value of his savings. On paper, it looks something like this, where the difference between Paul's savings and the tariff income threshold is £1,500. Divide the £1,500 by £250 and Paul's contribution to his care goes up by £6 per week. Conversely, the council's contribution is reduced by £6. If Paul's savings and assets were less than £14,250, they would not be considered in the financial assessment and his contributions would not rise. Those who have more than the upper limit of £23,250 in savings and assets will be expected to pay the full cost of their care. The Harrow Meals on Wheels service delivers to around 300 residents who meet the eligibility criteria. The meals reflect the diversity of Harrow's community and can meet the health requirements for people with specific dietary needs. Beyond that, the Meals on Wheels service plays an important role in the lives of vulnerable residents. Our drivers are trained to spot issues such as poor health, and their visits also provide a welcome social interaction. The Meals on Wheels service costs more than £488,000 a year to run, almost £315,000 of which is recovered from service users by way of meal charges. The shortfall of around £173,000 is subsidised by the council. Currently, there's a blanket price for all meals of £4.65 for a hot meal or £3 for a frozen meal. One of our proposals is to remove the council subsidy for the service, which means raising the price of the meals. So let's take a look at what that might mean for one of our users. This is Aisha. Like all users, she's currently paying £4.65 for her Gujarati-style daily hot meal. There are two options being put forward for consideration. The first option is for everybody to pay £6.47 for their meal, regardless of whether it's hot or frozen, standard, kosher or Asian. The second option is for everyone to pay the full cost of the meal they receive. This means a standard hot meal costs £5.67, frozen costs £4.55, a hot kosher meal costs £10.19, a frozen one costs £9.76, and a hot Asian meal comes in at £7.95.
The price of Meals on Wheels is reflected in how many people use them. The more people use them, the price would go down. The less people use them, the prices would rise.
Another area where we're looking to make savings is community transport. A variety of transport services are available, including Adult Social Care Services transport, blue badges, taxi cards and dial-a-ride. Our minibus service provides more than 1,200 journeys each week to around 250 users. Our aim is to continue to provide transport to those that need it, but we need to ensure that access to the service is allocated fairly with priority for those with no alternatives. We're proposing to introduce questions about an individual's transport needs as part of the resource allocation system, and also including transport in the personal contributions that service users pay towards their care. It should be pointed out that blue badges and freedom passes do not come under the remit of this consultation, and holders of these will not see any changes to these schemes. The consultation is, however, looking at community transport minibuses and the eligibility criteria for discretionary freedom passes and taxi cards. The people who will see the main changes are those who hold a freedom pass, a taxi card and a blue badge, or some combination of the three. People who have both a freedom pass and a blue badge will be entitled to a taxi card with a maximum allocation of 26 trips a year. Those who hold either a freedom pass or a blue badge but not both will be entitled to a taxi card and can take up to 52 trips annually. If you don't have either a freedom pass or a blue badge but are entitled to a taxi card, you will be able to take a maximum of 104 trips a year. And if you have a discretionary freedom pass, you will not be entitled to a taxi card, and vice versa. We are proposing to restrict eligibility for discretionary freedom passes to only a limited number of exceptional cases, and for those who meet the criteria for mental health needs. Let's look at how that might work for one of our service users. Imran has recently had a severe mental illness and has been advised not to drive. As part of his rehabilitation, Imran attends the mental health daycare service twice a week, but is worried he can't afford the public transport costs. As he qualifies under the mental health needs criteria, Imran is entitled to a discretionary freedom pass and can travel within Harrow at no cost. If Imran had not been assessed as needing to attend mental health daycare, he would not have met the proposed criteria for the discretionary freedom pass. For those users who have access to a range of transport options, we are proposing to limit their annual allocation of taxi car journeys. This ensures the fairest distribution of the service, prioritising those who have no other option. This is Jenny. She has a freedom pass, a blue badge and a taxi card. Jenny uses her freedom pass when she's feeling well and able to travel independently, but when she needs to do her shopping, she can't use public transport. Jenny's carer has a car and takes her shopping once a week, where they're able to use Jenny's blue badge to park near the shops. Jenny also has a taxi card which she uses to attend community groups and evening classes. The changes mean Jenny could only use her taxi card 26 times a year and would have to use public transport or get a lift from someone when her allocation has been used up. We've looked at how the proposals we're putting forward could affect some users. Now let's take a look at the different ways you can manage your personal budget. Earlier in the video we talked about the personalisation of social care. Essentially, this means giving the service user more choice, control and flexibility over the services they use. Once your personal budget has been allocated, you can choose to take it as a cash personal budget, where you manage your own care arrangements, or you can opt for a managed service where the council manages your personal budget on your behalf. You can also mix and match both systems for different parts of your care package. Let's take a look at how the cash personal budget works. This is Yolanda. Her care needs cost £143.25 for daycare activities 3 times a week. Under the existing policy, Yolanda makes no contribution towards the cost of her daycare activities. The council funds the full amount and makes a direct payment to Yolanda of £143.25 per week. Yolanda has been financially assessed to be able to contribute £30 per week towards the cost of her care and has opted for a cash personal budget. The council will offset her £30 per week contribution and will now fund £113.25 per week, which will be paid to Yolanda as a direct payment. If you or someone you know has access to a computer and you would like to choose your own care services, go to the website shopforsupport.com. You can set up an account and choose whatever services you need, from leisure activities to home help, from a range of safe and approved providers. If you don't have access to a computer or don't wish to make your own care arrangements, you can opt for a managed service where the council makes all your arrangements for you. Let's take a look at how that might work. Edward's care needs cost £95.50 per week, which goes on daycare activities twice a week. Under the existing policy, Edward makes no contribution towards the cost of his daycare activities. The council funds the full amount of £95.50 per week and makes arrangements for his daycare activities. Edward's been financially assessed to be able to contribute a maximum of £65 per week towards the cost of his care and has opted for the council to manage this for him. The council will now fund £30.50 per week and will send Edward an invoice for the balance of £65 per week, which he pays by direct debit. If you're assessed as needing adult social care transport to access your daycare, the cost of your transport will be included in your personal budget. This means that if you're financially assessed as being able to contribute towards your daycare costs, your contributions may rise to cover your transport needs. You can find a lot more information about this consultation in the documents we're making available in libraries, day centres and one-stop shops, as well as online. We're working hard to ensure this process is carried out fairly and doesn't place an unaffordable financial burden on any of our users. When the proposals are agreed in October this year, arrangements will be put in place to help ease the transition to the new system. No decisions on any changes to services have yet been made or will be made until the end of the consultation period, and it's not too late for you to have your say on the proposals and help shape the future of Harrow's adult services.
The consultation finishes on August. We have public meetings arranged up to that point. We also have a vast number of meetings arranged by our partners in the voluntary sector. People shouldn't be frightened We're certainly not taking away things. We're trying to do it in the fairest way possible so that our services, which you've been enjoying for many years, are sustainable and we can carry them forward. If you look around the country at the moment, you will find there are councils that are having to cut services all over the place, and we are determined at Harrow not to do that.